Dr. Ha Yu points at the Health Care Voucher Scheme logo in the clinic and tells the audience that he is going to show them how to use health care vouchers wisely. He says to the camera,
等我教大家精明咁用長者醫療券呢。
The shot shows an elder finishes his consultation and thanks the doctor.
唔該，醫生。
The screen shows the elder and the nurse at the cashier. The super shows ask about service fees. Before payment, the elder asks the nurse about the service fees. The nurse gives the elder an invoice, tells him about the service fees this time, and asks if he would like to pay with vouchers. The elder indicates his wish to use the vouchers. He says,
幾錢啊？
呢個係今次嘅診金，都係用醫療券。
係啊。
The nurse and the elder are frozen. The super shows using vouchers should not affect service fees. Ha Yu enters the frame and reminds the audience that use of vouchers should not affect service fees. He says,
有冇用醫療券都唔應該影響收費。
The nurse then requests the elder to show his identity card. The elder gives the nurse his identity card.
身份證啊，唔該。
The nurse passes to the elder a consent form for using vouchers, points at the voucher amount as shown on the form with a pen, and asks the elder to sign if he agrees. The super shows check consent form before signing. The nurse says to the elder,
呢個係今次會扣嘅醫療券金額，同意嘅話就簽名啦。
The scene changes and shows that everyone in the clinic is frozen. Ha Yu stands at the middle of the screen. The super shows leave your contact number. Ha Yu walks forward and at the same time reminds the audience to check the details before signing the consent form and to leave contact phone numbers so that the Department of Health can verify their use of vouchers when needed. He says,
簽之前對清楚同意書上嘅資料，留埋電話，衛生署有需要時就可以聯絡你核實記錄。
At the end, the shot shows that Ha Yu points at the Health Care Voucher Scheme logo and call on the elders to make good use of their vouchers. Logo of the Department of Health is shown at the bottom right corner of the screen. Ha Yu says,
記住善用醫療券啦。